Bismillahirrahmanirrahim. Today we will have case quiz number 125. Case data: 24 years old female. The patient is pregnant. She is 120 centimeters tall, so it is short in stature, with short upper and lower extremities but normal torso length. The patient had significant depression of the nasal bridge with bulging forehead. Her husband is phenotypically normal and he has no medical problems. The patient knows that there is a 50% chance of passing on her condition to the fetus. So she was told that there is a 50% chance that her baby will have the same condition as her. So, what is the diagnosis? The answer is achondroplasia. Achondroplasia. These are the achondroplasia features: macrocephaly, frontal bossing, mid-face hypoplasia, rhizomelia, shortness of limbs, especially proximally, trident hand, genioverum. These are the main features of the achondroplasia syndrome. Discussion of the diagnosis. This patient's limb shortening with normal torso length, specific craniofacial features, frontal bossing, and mid-face hypoplasia, and the risk of passing the condition to her offspring with 50% chance are characteristic of achondroplasia. The condition is caused by an autosomal dominant point mutation in the fibroblast growth factor receptor 3 FGFR3 gene, with 90% are de novo with unaffected parents and 10% are inherited. Because the mutation is autosomal dominant, the fetus of an affected and unaffected parent had a 50% chance of inheriting the mutation. Achondroplasia affects endochondral ossification, the process that makes long bones such as humerus, femur, and phalanges, and portions of the skull and face. In endochondral bone formation, mesenchymal cells differentiate into chondrocytes that secrete cartilage matrix. These chondrocytes continue to proliferate through childhood, forming an elongating cartilage template that progressively becomes calcified and later invaded by osteoblasts, osteoclasts, and blood vessels originating from the periosteum. Deposition of osteoid matrix over the septa of the calcified cartilage matrix forms woven bones, which then undergo remodeling into compact bone. FGFR3 is normally responsible for limiting chondrocyte proliferation during endochondral ossification. In achondroplasia, FGFR3 becomes constitutively activated, causing exaggerated inhibition of chondrocyte proliferation that results in the characteristic bone shortening and craniofacial abnormalities. So what about the key messages of this case? Unlike the process of intramembranous ossification that forms flat bones, endochondral ossification proceeds along a cartilage template and is responsible for the formation of long bones. Achondroplasia is characterized by an exaggerated inhibition of chondrocyte proliferation in the growth plates of long bones and manifests with proximal limb shortening, mid-face hypoplasia, and macrocephaly. And thank you very much for your attendance, and we will meet you tomorrow with case quiz number 126. Wassalamu alaikum wa rahmatullahi wa barakatuh.